Did you know?
The best way to protect yourself from the COVID Delta variant is to get fully vaccinated. Get your vaccine today.
Find out more at kingcounty.gov/vaccine. Did you know?
Hi, it's Queen Bree, Director of Clean Greens Farm and Market, and your host of Clean Greens Living Live, broadcasted on Rainier Avenue Radio.
And me, Robin T.
We are here to invite you to our biggest celebration of the year, our annual Lottie Cross Harvest Dinner on Tuesday, November 16th at 6 p.m. Check out our cool lineup. We will be having a sit-down chat with the one and only Doug Baldwin Jr. We also have in the house DJ Mr. Nice Guy, raffles and pictures from our very own comedian and activist, Deontay Damper, and the rest of our Clean Greens Farm family.
Get tickets by emailing us at cleangreensevents@gmail.com or go to our website at cleangreensfarmmarket.com.
Holla!
Different rules apply when it gets this late, you know what I mean? It's like after hours.
Whatever gets you through the night, it's all right.
Hello, I'm an unpaid spokesman for DJ Sotovaci. I'd like to invite you to listen to his free-form music show. It's popular music the way it was never intended to be heard. Whatever gets you through the night, late nights, here on Rainier Avenue Radio.world.
Whatever gets you through the night.
Rainier Avenue Radio, your community radio station.
This is Cindy Gray, the host of Heartbeat Radio.
This is Paul Thierson, host of Star
This
Time.
is Paul Schneider today on the 73rd edition.
Hey,
of
y'all,
Sports
welcome
on
to
Rainier
Travelers
Avenue
Guide to
Radio.
Venus and Mars and Princess Robin.
Risha Fairy Godmothers. You guys know me.
Dirty Harry.
Your home for information about the impact of the
coronavirus.
coronavirus.
Amongst many things that difficult about this virus is that it prevents
it's been devastating. They're really heartbreaking stories of people who have.
There isn't anyone that isn't impacted.
Shutting our schools down, including all athletic programs.
Your first-hand accounts.
I got here just to test, and I found out that I was positive.
A lot of people who know me, I'm still the first person they know.
But it was almost like you were patient zero for South Seattle. Your stories of community coming together.
Partner very heavily with Tacoma Urban League, who is doing some amazing work in response.
We're doing things for small businesses. We're giving out loans to small businesses.
And so I think it's very important that we have leaders who feel protected.
I mean, I cannot tell you we're calling 20, 30, 40 members.
This crisis in our community, we've been working to address it.
Rainier Avenue Radio, broadcasting 24 hours a day, 7 days a week.
DJ Dirty John.
Karen Z with Rainier Avenue Radio.
Hey, this is Sergio Cool.
Rainier Avenue Radio.world.
Rainier Avenue Radio.world. We got you covered. Local impact, global presence.
We broadcast. Welcome to Rainier Avenue Radio.world and our weekly coverage of the impact of the community. Continuation of our series. I'd like to thank everyone for joining us again here. And then again, now we are aware of the fact that we are and more folks listening.
Hey, Buford, why are you kicking that old CD player?
Because I can't hear the radio.
Can't hear the radio? Let me help you.
Hey, you two, quit beating up that outdated audio equipment. You can't hear the radio on a CD player.
You can.
No, you can't, you adorable simpletons. But you can hear some great radio on the Rainier Avenue Radio app. It's brand new, it's free, and it's available for Android and iPhone. In fact, you can download the Rainier Avenue Radio app right now from the Google Play Store or the iPhone App Store.
I'm going to go give me a smartphone right now.
I'm just going to put a graduation cap on my rotary phone.
You two have very significant personal issues. Get the Rainier Avenue Radio.world app today.
Welcome to the coronavirus pandemic. I'll take coronavirus for 100. Fever, chills, shortness of breath, loss of taste or smell. What is staying home and isolate? Correct. Coronavirus for 200. Inability to stay awake, persistent pain or pressure in chest, trouble breathing. What is seek immediate help? Correct.
Coronavirus for 500.
Crippling and potentially dead infectious disease eliminated the United States with vaccination.
What is
polio vaccine?
Correct!
I'll take coronavirus for 700.
The Daily Double! Should I take the coronavirus vaccine?
Wait. Hold up. This is not a game. It's time for serious discussions. We have coronavirus vaccines, but not everyone is comfortable taking them. Here's the facts. Based on what has been proven about vaccines for other diseases, COVID-19 vaccine may help keep you from getting seriously ill, even if you do get the virus. Getting vaccinated also may protect people around, particularly those at greater risk for severe illness from COVID-19. We don't yet have all of the answers. Get informed, talk to your healthcare physician, and make the right decision for you. This is a message supported by the Washington State Department of Health.
This is Rainier Avenue Radio.
We got the feeling now?
R&B, soul, funk, 50s, 60s, 70s, 80s. We give you all that and more on Star Time. Join me, Paul Pearson, for a 2-hour trip through the history of R&B. A new episode every week on Wednesday at 2 p.m. Come and get the feeling on Star Time on RainierAvenueRadio.world.
This is Brenda Charles Edwards, host of Seniors Matter. Join me every week to get information on activities and issues that impact the lives of older adults and their families. That's Seniors Matter every week on Rainier Avenue Radio.
November is American Indian Heritage Month, so please join RainierAvenueRadio.world to celebrate all month long the history, the contributions, and the accomplishments of our first Americans. Again, please stay tuned to RainierAvenueRadio.world to celebrate and honor American Indians during American Indian Heritage Month.
Yo, what's good? It's D-Money, and you should definitely check out Fresh Juice every Wednesday, 9 to 11 Pacific, right on Rainier Avenue Radio.
With pint-sized Patron, P-Treasy the Don. Y'all be sure to clean your mirrors as we play brand new hip-hop and R&B from locals and worldwide.
It's ID Yourself, a.k.a. Malcolm Flex. Make sure you check out Fresh Juice every Wednesday, Pacific Standard Time from 9 to 11 p.m.
And to get those exclusive interviews that we be doing.
Sipping a brand new fresh juice every single week.
Yeah. Every Wednesday, 9 to 11, Rainier Avenue Radio. Yeah.
On RainierAvenueRadio.world, look for the Change Your Food, Change Your Life show. I'm Dennis Weaver, your good food guide and host, helping you to feel good and look good, and who wouldn't want some of that? All that and more from the Change Your Food, Change Your Life show on RainierAvenueRadio.world. Stories, songs, and guests. Begin living the organic good food life, and the rest of your life just may be the best of your life. To your health.
This is Rainier Avenue Radio.world.
Welcome to Rainier Avenue Radio. This is Afternoons with Monique, recording live in Seattle, Washington, every Thursday at 1 p.m.
Good afternoon, Seattle. This is Monique Lee with Rainier Avenue Radio. You're on the Afternoons with Monique show, and I apologize for running a little bit behind there. Today, I have the pleasure of inviting Dr. Jeffrey Duchin, a doctor that is in our community for a long time, and he's currently the chief of Communicable Disease Epidemiology and Immunization section of the Public Health Seattle and King County. He also is a professor of medicine at the University of Washington. Please welcome to Afternoons with Monique, Dr. Duchin.
Hi, Monique. Thank you for inviting me.
Yes, thank you, Dr. Duchin, for coming on my show. The pandemic is still going on very much around us, and we have a lot of people talking about the vaccine mandate, and that's why I thought it would be a good time for an authority like yourself to come on the show and explain some of the concepts that perhaps have been missed out, anything that people want to know, and I personally am curious about, and I'm sure a lot of people want to hear about, or would love to hear a little bit more about that. So let's start off with a little bit of your background. You know, you have an MD and you've been practicing medicine for a long time, so clearly you're a very credible authority in this subject, communicable disease.
Yes, thank you, Monique. I started my career as an internal medicine doctor I practiced emergency medicine in Philadelphia for 6 years at the Hospital of the University of Pennsylvania. And then I transitioned my career to public health, worked for the CDC for a while, and then came out here to Seattle, where I became a specialist in infectious diseases at the University of Washington, and have been working with the university and the public health department, Seattle King County, since the early 1990s.
Right. And how long have you been the chief of King County Public Health Seattle and King County chief of communicable disease?
So I've been overseeing the communicable disease and immunization program since 1998.
Okay. So it's been a while. Okay.
It's been a while.
And were you a professor at the UW for a number of years? Are you still teaching?
So it's a process. You start out as an assistant professor, and then associate, and then professor. And I do teach, but I have to say, since the COVID-19 outbreak, really it started for us at the late 2019. I've been doing almost 100% COVID work with the health department.
And that's plenty, right? That's plenty of work for you to do.
Unfortunately.
So, right. So as a health officer, what role do you play in all the COVID protocol?
Well, I work with our teams. We have a great department, Public Health Seattle King County, lots of experts on our staff. We have people who work both at the community level, front lines, and at the policy level. We have analysts, epidemiologists, data experts, and we've got a variety of different amazing people that I've been very grateful to be working with through this really rough time. My role is to support them, to help them do their jobs better, to help us understand what direction we need to be moving in as a community, as a public health department, and to help us get the best outcomes possible for our population. So that can be through policy development or working with community partners, a whole variety of different strategies we have to promote health and well-being.
Right. Now, the vaccine anti-vaxxer had been around for a long time. And we know that even before COVID-19, we have a number of people that believe that immunization cause conditions such as autism or ADHD, and there may be some data and scientific research that validate a number of people may be affected because of the vaccine, and therefore there's a group of anti-vaxxers who is very vocal right now about the COVID-19 vaccination. Could you elaborate on what's true, what's not? And clearly the medical community, the doctors are very strongly proposing or supporting the vaccine for the public for herd immunity. But is it true that a number of people, as long as we reach that herd immunity, that a number of people could, be around not vaccinated and the public would still be safe?
Well, early on when COVID first emerged, there was a lot of talk about the possibility of reaching herd immunity where we get enough people vaccinated or unfortunately infected that had immunity so the virus couldn't spread from person to person in the population. Unfortunately, it turns out because of the way that virus has evolved, and particularly right now, the Delta strain, it is so contagious and the immunity is not long-lasting lifetime immunity that people can be infected over time. Particularly if they're not vaccinated. And so the idea of herd immunity is more better to think of in the context of herd protection. This virus is not going to go away, and there's probably not a magical number of people who, once they're vaccinated or infected, will automatically shut down the spread of this virus. Mm-hmm. However, people who are vaccinated will develop protection from the serious illnesses that the virus causes. So the virus will continue to spread, so we won't have true herd immunity, but we will be able to reach herd protection. Now, the difference between herd immunity and herd protection is in order to be protected, you need to be vaccinated. And we know that even if you've been infected, you do get benefit from being vaccinated. So I strongly encourage anyone who has had COVID-19 to also be vaccinated, because although it's true that COVID-19 infection can produce good immunity for 6 months or so, we can't tell who of those who've been infected will develop that immunity, how long it will last, and how good it is. There's no test that can tell us that right now. And we do know that people who've been infected get benefit, better immune protection, more durable and more broad against variants that might emerge if they're vaccinated. So we can get herd protection through vaccination, but we won't get herd immunity in the sense that this virus won't stop moving around. It won't go away. We probably have to learn how to live with it for the long term.
Right. When you were talking, we were talking about the number of people that choose not to vaccinate. Some people are waiting for data to validate, the death, the mortality rate, and they want to see, a couple of years pass. Maybe then they feel like the technology of vaccination or the testing would be revalidated sufficiently so that they will step in and now they would be vaccinated. Should they be waiting? Is there any more improvement in the vaccination process that can be had at this point? Is there any benefit for waiting?
Yeah. So, whether or not someone gets it, first of all, these are reasonable questions. It's natural and understandable and good that people have questions about vaccines and any health measures they might take, medications, procedures, et cetera. With respect to the COVID-19 vaccine, this vaccine now has been given to over 200 million people just in the US. Mm-hmm. We have a lot of experience with this vaccine. It's been given to over 8 million 12 to 15-year-olds. And so this is a vaccine that has been given to a lot of people.
Been studied
more than any other vaccine in our history. There are more safety systems in place looking at this vaccine. Okay. So when you make that decision for yourself about whether you want to get vaccinated, you need to look at the risk and benefit. What is your risk of getting COVID-19? What can happen to you? Some people get mild cases and recover fine. Others end up hospitalized and some die. The risk from the vaccination is very low. There are some, depending which vaccine you talk about, J&J or the mRNA, there's some rare complications, and there are ways to minimize those risks from the complications. For example, if you're a woman under 50, you would be well advised to take an mRNA vaccine, which does not have some of the risk for a rare complication called TTS, thrombocytopenic syndrome, that the J&J vaccine has. But overall, with the degree of COVID-19 spread that's happening in our country and around the world right now, with the number of people who get sick, are hospitalized and die, the benefit of this vaccine, most of us believe, greatly outweigh the small risks, and we do have a lot of experience with it. Now, that said, I think it is important for people who have questions to look at the safety and effectiveness data, to look at the impact of COVID-19 on their communities, their family members, and their friends, understand the severity of disease, understand the vaccine and its safety record. And based on that, of course, we know that the vast majority of people are getting vaccinated because they see that the risk from the disease is much greater than the risk from the vaccine. So I understand why people have questions, and I hope that people take time and get reliable information that will help them to make the best decision for themselves, their families, and their community.
Right. The reason why I thought this is a very timely episode is because I've been reading on the Seattle Times, King County, Seattle City, and a lot of public organization, public agencies. People object to the vaccine mandate despite losing their job and unemployment benefit, some people hang on to this belief. So there must be some beliefs out there that the benefit of not vaccinated could be outweigh the benefit of having a job, having an income. So there is a lot of misinformation there seem to be, because clearly from what I'm hearing, the benefit of having the vaccine is outweigh the other risk out there. So would you give, and you are the perfect person for me to ask this question, just in terms of advice. Let's say usually you go into a surgery, the doctor will inform you of the risk of complication percentage-wise. How much really is the risk of complications for a vaccinated person to experience serious complication from the vaccine, such as, maybe ailment or death? What is that percentage, if I may ask?
It's extremely low. I mean, we really don't have precise numbers for serious outcomes because there are so few that have been associated with the vaccine. I can tell you that, they're negligible. This is considered to be an extremely safe vaccine. There are three things that have come up. One is severe allergic reactions, which are around 1 in a million, which are they're treatable and they occur at the time of the vaccination. Very few people have them, but they are serious and can be treated. The other two conditions that have come up as safety issues are myocarditis, which is an inflammation of the heart, which is more common in young males. And, we're talking about something like 10 to 15 cases per 100,000. The vast majority of these people recover without complications within a couple of weeks. The latest data that was presented from the CDC, where they talked to the cardiologist who took care of the patients with myocarditis, 93% reported their patients were better by 3 months. So we know that the risk of cardiac damage and cardiac disease and other complications from COVID-19 is much higher than the risk from the vaccine. And then the third condition that's come up is this condition called thrombosis with thrombocytopenia syndrome. Also incredibly rare, talking about handfuls of cases in the millions in women who are primarily women under age 50. And that again is a complication that can be avoided if women under age 50 choose an mRNA vaccine, and you do have a choice about which vaccine you get. So the adverse events, the side effects, if you will, from the vaccine, the serious ones that have come up are extremely rare, whereas, of course, 750,000 Americans have died from COVID-19. And so we know that,
there's a much larger number.
Yeah, the risk of this virus greatly outweighs the small numbers of
complications,
cases that have happened, adverse events that have happened. Now, it's not to minimize it. Those are serious, but they're uncommon, and the risk from the virus is much greater.
Just to put it into context, how the negligible number of death, and this is just for my morbid curiosity, the risk of death from vaccination, that negligible number, do you have that figure?
I have not seen anything that's, we know that the risk of death from the virus is very well characterized. The risk of death of vaccine, it's minuscule. I have not seen. We don't know of a single case that's yet confirmed of myocarditis death. There have been, I believe, 5 or so cases of death from the thrombotic thrombocytopenic syndrome. So that's 5 out of over 200 million doses that have been given in the U.S. Versus 750,000 deaths from COVID-19. I do not know the small number, if there have been deaths, the small number of deaths that would be associated with severe allergic reactions. But again, that's a 1 in a million event to start with, and most of those people survive. So the risk of death from associated with vaccination,
it's extremely low. Okay.
Counted on your fingers and toes right now, as far as I can tell.
Now we have about 3 more minutes or so left, and I want to ask a couple more questions. And originally I was going to ask you about policy, but I'm also wondering about children vaccination. Initially, the government did not require that, but now we are requiring it because of the Delta variant. And even children as young as under 12 are being recommended to have it vaccinated. Why do you think that is?
Sure. And let me just start by saying vaccine is recommended for children 5 to 11, in addition to, well, basically everyone 5 years of age and older now, but the new group is 5 to 11, recommended, not required. We hope people get these children vaccinated because there have been almost 2 million cases reported of COVID-19 in children 5 to 11, over 8,000 hospitalizations, 94 deaths that we know about in the US. This is now the number 8 leading cause of death in children 5 to 11. Now, children 5 to 11 don't usually die, and they shouldn't die. And death from COVID-19 is not common, but among children in that age group, it's now the 8th leading cause. And of course, we all know about the disruption that COVID-19 has caused to the lives of children related to schooling and the activities that they have not been able to do. So the disease is an important problem for children. And again, we have this very strong safety record, both in older children, the 12 and older group, in the 8 million doses given to children 12 to 15, 200 million doses given to adults, with a very strong safety record. And the clinical trials that were done on the 5 to 11 group to look at safety did not find any serious safety signals. In fact, they found that children in the 5 to 11 group are less likely to have even the local side effects like sore arm and fever or swelling or chills, any of those things after vaccination, less likely than older children. Now, they get a lower dose, and that's one of the reasons why they're less likely to have even the local side effects. But that dose was shown to be over 90% effective in preventing COVID-19. So for all these reasons, to protect the children, to protect the families of the children, because kids can spread the virus, COVID-19, to their family members, some of whom may be at high risk for serious illness, to the school setting, to other community settings. This vaccine will provide tremendous benefits to the children, families, and communities. For that reason, it was recommended by the CDC, but also by, and this is important, the American Academy of Pediatrics, the American Academy of Family Practice, and other organizations that really exist solely because they have the health and well-being of children as their top priority. Everyone feels like this vaccine is going to be a really important way to improve the health of children in the U.S.
Well, thank you so much for this information. It's very informative, Dr. Duchin. And thank you for coming on Afternoons with Monique. Everyone, you have today Dr. Jeffrey Duchin from the Department of Communicable Disease and Immunization section of the Public Health, Seattle and King County, also a professor at University of Washington, professor of medicine, sharing information on COVID-19 update. Thank you. Have a good afternoon, everyone.
Thank you, Monique.